Today's class, we're going to focus in on the external female genitalia, the clitoris, the labia, the mons veneris, things that you either know or don't know already. Then we're going to talk about the internal organs, the vagina, the uterus, the fallopian tubes, etc. And then we're going to spend some time talking about the menstrual and ovulatory cycle. I'm going to go over that 2 or 3 times. I really want you to know it, and all this will be posted as well on Blackboard for you. I'm not going to post it tonight. I'm going to wait until I have all the lectures complete, then I'll post them for you. If we have time, since our videographer is here today, and friend, Jake, we'll probably move right into contraception. It depends on how much time we have. That's why I'd like to begin. Last class, we spent a half hour on Q&A, and it was a very good class. So let's pick up where we left off. Please ignore the cameras. Let's get going. And I want to talk about the external genitalia. Now, if there's any myths and fallacies and stuff that you want to talk about, just let me know along the way. Either I will cover it when you ask the question, or I will get back to it at another time. All right? Can you, all right, you're all right. Is she okay? Yes. All right. You ready? So we're going to talk about anatomy, where things are, where they line up, a little bit physiology, how things work, ovulation and menstruation. All right? Now, around 7 to 8 weeks of development, in the male, the gonads begin to develop. I told you in one of the first classes on the male that we all start off as female, and you have these Wolffian and Mullerian ducts that transfer us to either remain female or turn into males. It comes from the same tissue. But high up in the abdominal region in the female, approximately 10 to 11 weeks of development, the gonads begin to develop high up in the abdominal area. And they also move down into place as well, but not unlike the male that moves through the inguinal canal and descends down. You don't have that in the female. They develop high up in the abdomen near the kidneys, and I just want, well, let me just tell you, when they look at the ovaries, and unfortunately they do autopsies, they have babies, they have young kids that pass away. When they do autopsies, they realize in young girls, adolescents, teen girls, the ovaries are very pinkish in color. There's no scar tissue. Obviously, that makes sense. They haven't really worked that hard. In older women, when they pass away, when they look at the ovaries, there's scar tissue across the ovaries. That's because every time you ovulate, every time there's a release of a mature egg, an egg will pop out. Maybe it will be picked up by the fringed end of the fallopian tube. Maybe it won't be. And scar tissue will cover that area. Now, I don't want to say that they're all scarred up and that's what happens when you get old. I just want you to know they're able to really determine how the ovaries function over time through these autopsies. So, What Women Want is the title of today. And I guess it's the title of a book, a movie, and all that stuff. Here's a picture of the external genitalia. I like talking about this first because unlike the male, where a lot of it is external, I believe the female is generally an internal system. Other than your external genitalia, this picture, most of the organs are internal, and they don't have any need to have cooler body temperatures like the male does to produce sperm. But this is generally what you have. You have the slides, you have your books, but I just want to go over a couple now. And I'll mention it a little more detail in a second. You have the mons veneris up here. This is the pubic region where pubic hair grows on it. It's a fatty cushion. In Latin, the mons veneris means mountain of love. I just like the term. There's many different terms that we call the mons veneris. We're going to go with that in this class. Right over here, you have the clitoris. The clitoris is the most sensitive part of the female genitalia. And right above the clitoris, you have tissue above it, which is called the prepuce, which hangs down over the clitoris I'll get to that as well. Down here you have the anal region. Right between the anal region and the vaginal region, you have the perineum. The perineum is an area of tissue in the female that is very important during childbirth. Not all doctors do this, but many doctors cut this peritoneal tissue, perineum. Oh, this is going to be good. They cut this tissue so that during birth you can relieve pressure on the baby's head. So this is called an episiotomy. An episiotomy is a procedure where you cut the peritoneal tissue, perineum, so you can relieve pressure on the baby's head. It's not conducted to prevent a jagged tear in the female tissue. It certainly does prevent a jagged tear, but that's not the rationale to do it. An episiotomy is to relieve pressure on the baby's head. Now, with all the different equipment available, they could tell the position of the baby, whether the head is in a good place, shoulders, any breech babies coming out. So an episiotomy is to relieve pressure on the baby's head. Now up here we have this little opening. This is the urethral orifice right here. That's right below the clitoris. That's just like the urinary meatus. This is the hole, the opening, where a female urinates from. You know, in the man, we had the urethra connecting the bladder to the outside. We have the same organ here, except it's internal, so you don't see it. It's the urethra, and this is the urinary meatus, same thing. But a woman does not urinate and have her menstrual cycle come from the same organ. This is the vaginal barrel over here, all right? We have the large lips, the labia majora on the outside, and then you have the inner lips on the inside, labia minora, and I'll cover that in a moment. So this is basically the external genitalia. No jokes, no funny sayings here. You know, it is what it is. This is when a female goes to the gynecologist and she goes for her exam. Generally, this is the beginning of a procedure. This is how it looks, and I want everyone to know that. Unfortunately, when people have sexual activity, 2 out of every 3 have dim lights, no lights, darkness. Well, if you ever turn the lights on or have lighter candles, this is what it would look like, guys, okay? If you've never seen one before. You know, because there's a lot of questions. Do you menstruate and, you know, urinate from the same spot? There's questions. There's different places, folks. It's really different. Here's her sensitive area. This is the mountain of love. This is where she urinates from. This is the vaginal barrel. Babies come through that opening. 21-inch babies, 10 pounds, coming through that little area, that 4.5-inch tube called the vaginal barrel, which can expand to almost anything. Okay, any questions? Seriously, what do you have? That's it? You're good? You good? Don't go deaf and dumb on me today. The mons veneris, as we talked about before, it's rounded, soft area on the pubic bone. This is where you have a lot of nerve endings, some protective tissue. It's fatty cushion on that pubic bone to protect your organs in general. There's nothing else to say about it. The labia majora are 2 large folds, and they're done to protect the vagina as well. Now, I want you to know they also fill up with blood supplies during sexual excitement. And between the labia minora, more the labia minora, the minor lips, and the major lips a little bit, when they puff up and engorge with blood, just like in the male, what happens is it opens the vaginal opening so it's larger and has more access. Because the vaginal barrel itself is basically closed off very often. But when these engorge up, it opens up the vaginal barrel for potential intercourse or whatever. And I'm not going to do whatever today. The labia minora, these are 2 folds of skin lying inside the labia majora. Let me go back to this picture. This is the most important aspect of the labia minora. You see how this tissue over here on both sides connects to the clitoris? I'm asking you, Can you see how it's like connected to it? Well, because it's connected to it, if there is any contact on the external genitalia at all, that includes with clothes on. It doesn't matter. You're going to have stimulation of the clitoris as long as you're in the vicinity. Do you understand that? Everyone's trying to figure out where is the clitoris. You know, I got to find it, that magic place. And of course, we have the Grafenberg spot, the other magic kingdom. I would not spend that much time worrying about where it is. There's no evidence that direct contact on the clitoris increases a woman's chance of having an orgasm. Direct contact has been shown to increase the speed at which a female does achieve an orgasm if she's capable, but not whether she has one, and has nothing to do with the amount of pleasure gained. We spent a lot of time on that. So knowing that the internal, the labia minora is connected to it, that means you're talking about a 3-inch, 4-inch area that is very sensitive to touch. Any senses, it's very sensitive to. Any questions? I'm very surprised. That's it, huh? The most sensitive portion of the female is the clitoris. Some people will argue that we spend too much time emphasizing this, that there's really vaginal orgasms. You will have contractions and relaxation in the muscles of the vaginal barrel. But it is now known that the clitoris is the center of the most sensitive portion in the female. Let's just not go overboard on it. You could still achieve pleasure without contact on it. It's covered by a clitoral hood, which is called a prepuce. And during intercourse, the hood stays over the clitoris. It's believed for protection. The female's so excited, has so many nerve endings that the prepuce hovers down like a shell and will cover the clitoral region. Just like the foreskin will pull down over the glans penis that we talked about. Same tissue. Then we have the urethral opening. You know, okay, the hymen. The hymen is where we emphasize when we talk about virginity. Breakage of the hymen. The hymen is only connective tissue covering the vaginal area. It doesn't cover it completely. Here you see different forms of covering. Sometimes they have holes in them. You don't need to know the names of each one. But early on, sometimes there's first of all, some women don't have an intact hymen. Others have injuries, monkey bar injuries, fell off the horse injuries, the bike did it injuries, you understand, which can tear the hymen. But in our society, we talk about virginity. This is it. Because of there's so many nerve endings in this particular area and blood, that the first time the hymen is torn, typically during intercourse, there's bleeding that goes along with it. I'll say pain and discomfort, whether it's minor or major pain, has a lot to do with whether there's foreplay or not, whether the genitals have a chance to lubricate. It takes the average female about 8 minutes in general to engorge with blood and to lubricate itself enough so that intromission of the penis is not as painful as it would be first time she has activity. Unfortunately, there's so much anticipation. There's so many things that mothers and parents have told you about loss of virginity that it's a quick activity. It's in, it's out, and you're looking. You know, you really want to speak to your mothers, girls. That's it? That's what you prepared me for my whole life? It was like a 50-yard dash. It went by so fast. 2 out of every 3, actually, 2 out of every 3 in research, but when I did my book, Sex Lives of College Students, 3 out of every 4 females were dissatisfied with the first experience. 2 out of every 3 in other research, so it's pretty high. And there's too much anxiety. There's so much on the line there. My opinion about it, of course, wait for the right partner. That's my advice. But I think the other part, the anxiety that we spend, this is it, this is sacred, when it happens, it kind of can be disappointing to some females because they can barely remember it. Some girls believe that if I can't remember it, I'm still a virgin. Some girls believe I was too drunk, I'm still a virgin. No, this is true. In Japan, for many years, they used to have operations to replace the hymen so Japanese men would think they're marrying a virgin again. They stopped, they reduced the number, but it still exists. There's such a premium paid for being with a virgin. Then the double standard comes right through this whole thing like a Mack truck, that it's okay for guys to not, to have had more than one partner or two, but if a girl's not a virgin, either guys are very happy or they're really upset. Well, the bottom line is, let's get over it. It's 2010. We know the statistics on junior high school and high school kids engaging in sexual activity, and by the time you're in college, don't think everyone is, but many students. And I don't want to go to the stat part, because we're talking about anatomy and physiology today. Any questions about this? Come on. Nothing? Yes.
What is the stat part?
What?
What is, like, one quick stat? Like, what's the percentage?
It is believed that about 20% of college kids are still virgins. How's that? Okay. The vagina, the internal organs. We're now moving to the inside. The vagina is a 3-4 inch tube-like structure that is very flexible, contract and can relax, has a lot of muscle tissue to expand, and it is the vehicle for which menstruation will come out of, as well as the vehicle to engage in sexual intercourse. It's probably our most discussed reproductive organ. We have plays written about, the vagina, and the vagina monologues, For 12 years now, it's been all over the world, this movie. But we talk about it. These are where the jokes are. It's so big in there, it's so small in there, all the stupid jokes that you hear. What about childbirth? Does it get larger? Guys have this impression that girls that have given birth, for instance, that their vaginal barrel's like the Grand Canyon. Listen, folks, it's muscle tissue. If it's fit, it will stay fit, and over time, all of your organs become less fit unless you take care of them. That's why it says up here, Kegel exercises. These are exercises to actually maneuver the vaginal muscles, usually on the exterior. Okay? Now, the Grafenberg spot. Let me move on. It's controversial. I don't want to spend too much time on it. It is believed that in the back portion of the vaginal barrel, there's a spot called the G-spot, which gives women sexual pleasure. My question to all of you is this: how do you get to that region without passing the external genitalia? How do you get to that region and touch that region without involving all other organs? So to think that there's a spot in the female that will make her gush, have an orgasm, multi-orgasmic, is kind of foolish, because you can't get there just with utensils, even in a doctor's office. All right? Now, I'm totally against discussing the Grafenberg spot, because when the research came out, they found out that there was some fudging of the data along the way. But I work with other faculty who believe that it's important to talk about. I'd rather not emphasize it, and on your test, whenever you have tests, in a week or two, whatever, I'm not going to ask any questions about the Grafenberg spot, okay? All right. Now, going back, this is the picture that I want you to understand regarding the internal organs in the female. We have the ovaries, and by the way, you have the same thing on the other side. I always like when they leave off one side. I don't know what they were thinking. You have the fringed end of the fallopian tube, the oviducts, OVI ducts. The fallopian tube carries an egg that might have been released down into the uterus. The uterus has 3 linings. I'll get to it in a minute. This is where housing of a fertilized egg will take place. This is where the developing embryo will be housed. This is generally about a 3 by 5 inch organ, about the size of like a small pear. And right down here we have the vaginal opening. Now, this is not the way the organ looks, because if you took a cross-section of it, this is the way it actually looks. And I have this in your slides, but it's more complicated when you do a cross-section. And then you have to start, angling up. So I go to the other one so that you have a pretty good, clear picture, just like I did on the male. Because I don't want you to be confused. And you're not going to ever get a cross-section, So here's some organ tissue relationships. So in the male, we have Cowper's gland, the pre-ejaculatory fluid. In the female, we have Bartholin's gland secretion. Bartholin's gland secretion in the labia helps lubricate the entire external genitalia. It will secrete some lubricant during the sexual response cycle. This will continue up until the age of about 40 to 45 in females. But a female does not ejaculate. She will lubricate. She will perspire in the vaginal area, as well as Bartholin's gland secretion will provide some lubricant. So when people talk about ejaculating females, some people believe that there's almost a prostate gland in the female, and it's down here. I don't really want to go there because, again, remember I told you I'm sorry, women do not ejaculate, men ejaculate, and, but you all saw your porn movies and you see things flying across the room, and I'm not going to disagree with what you see in special effects, okay? But, and I'm not saying that women, when they lubricate, that there isn't a fluid. It's not seminal fluid. It's not nothing like it. It's almost like sweat and sweat gland secretion. So if it's almost like that, it is. We have the penis and the analogous organ in the females, the clitoris. They stand erect. They're very similar in nature. In fact, do you remember the 3 components that make up the penis? The corpus cavernosa and the corpus spongiosum, 3 tube-like structures in the penis. Well, the female has the corpus cavernosa as well in the clitoris. Same type of thing. It engorges with blood. The clitoris will stand erect, just like it will have an erection. And the prepuce will cover it right before the orgasmic phase, during the excitement phase of sexual response. So the tissues come from one another, or they're analogous to each other. And then, of course, we have the testicles and ovary for gamete production. So you could see, of course, the labia and the scrotal sac come from the same tissues. Any questions? Okay, the uterus. Now, I said a pear-shaped hollow organ with muscular walls. The cervix is the bottom portion. Okay? Right over here is the cervix. This is the bottom portion of this uterus. Okay? And then we have the corpus, which is the body. And then we have the isthmus, which is the top portion. All right? So we have the isthmus on top, up here. We have the corpus, the body, and we have the cervix. A pencil-like, pencil-thick organ, which the baby will eventually come out of. That's when you have effacement to opening up the lining and dilation of the cervix. You got time to worry about that. Now, there's 3 layers in here, the perinetrium, the myometrium, and the endometrium. Let me get rid of the first one and talk about the other 2, because there's really, I don't want to confuse you. There's the myometrium, which means myo, muscle lining, and the endometrium, which is one part remains on the wall of the uterus. Each cycle, a female will prepare herself for getting pregnant. And the endometrial lining will engorge with blood, nutrients, in case you get pregnant. But you have a tissue there that stays intact. and then there's a second endometrial lining that grows on top of it. And the reason I'm telling you that is people think that the entire endometrial lining is gone, but there is a part that stays that the other lining grows on top of. Then you have the myometrium, which is the muscle portion of the uterus. And this is for contracting, relaxing. This is to elongate when you have a baby coming housed there but needs to get through. So I want you to know the myometrium, muscle lining, and the endometrium are the two linings I want you to remember for this class. The fallopian tubes and ovaries. Now, let me see if I got a picture again. All right, let's go through this. In fact, I have another one here. Let's use this one. You could follow along. Here's what happens in general, and then I'm going to give you more specific understanding of what happens. In the ovary, and by the way, you have 2 ovaries, each containing between 200 and 400,000 immature egg cells at birth. These are called follicular cells. 200 to 400,000 cells at birth. When a female gets through puberty, into puberty, by the way, around age 8, the female starts remodeling her body. You have estrogen and other hormones being secreted, which causes budding of breasts. It doesn't happen overnight. It doesn't happen when you're 8. But around age 8, you start getting more fatty tissue in the mid-region. Your center of gravity changes. You have an elongation of bone, the epiphysis of the bones, elongation. What does that mean? Well, if you happen to ever go to a dance in 5th grade, why are the girls always taller than you, guys? Because they grow sooner because of these hormones. And then one day in high school, you remember me? You know, guys are so happy. But, you know, this is the way it's like in 5th grade because a woman starts remodeling well before a guy does. She starts around age 8. So by the time she's 12 in that region, she had 4 good years of developing things, developing breast, widening of the hips, more fatty tissue in this genitalia region. Okay? And if you're the first one to develop or the last one to develop, everyone's always making fun of you. There's a huge amount of anxiety with puberty and kids. They're cruel. You know, especially budding of breasts. Ladies, cruel, guys? Hello. Anyone ever know of anyone that was made fun of? You? Let me hear. No? This doesn't happen? Oh, everybody does. But did you? Okay, no, let's not talk for everyone. And there's nothing to be embarrassed about, but you got those names, you know? The carpenter's dream. Flat as a board, easy to screw. These are guy talk, you know? This is when girls don't develop enough. All these terms are stupid. But girls hear them. Someone else had their hand up? What, are you talking amongst yourself, but you don't want to talk here? What did he say? What did he say? Mosquito bites. And girls who develop early with budding breasts, they very often don't want to wear bras. They put T-shirts on, layered clothing. They don't want anyone to know what they got there. And it's really a weird thing. You know, I only have a daughter, so I don't know about any of this. When she was 5, she already had some of my textbooks hidden under her bed, you know, the sexuality book that you got. So who knows what she was reading, you know? She actually helped me write my first book. She would use a glue stick and paste things together. And I said, you can't read it, though, when she got old enough, you know. Any questions about remodeling? All right? So here's what happens, though. You have this idea that it just happens all at once. Once FSH is secreted, I'm going to go over different hormones, but once follicle-stimulating hormone is secreted by the anterior pituitary gland, what happens is you have developing egg cells. And although only one egg cell is released during ovulation, there are many egg cells that begin to develop. So inside the ovary, about 10 to 15 egg cells begin to mature. Do you got that? It's not one. And they're at different times, they develop at different paces. And then if by chance one is released, the release of a mature egg cell is known as ovulation. It is released here. You notice this little piece over here? The ovary is actually attached by an ovarian ligament. It's not by bone. It's not connected to anything else. It's a ligament. It's actually floating in the abdominal region. Yes?
Is egg cells and molecular cells that you mentioned, 200 to 400,000, are those the same thing?
200 to 400,000 follicular cells or immature egg cells.
So those are the same?
Same thing. Yes. Okay, so an egg is released. So remember, you have 10 to 15 that are developing, right? Are you with me? You got to let me know, because I'm turning my back. If you have 10 to 15 develop and one is released, then you have about 10 to 14 that still remain inside the ovaries. So one is released, it's floating around. The fallopian tubes, the oviducts, have these hair-like structures inside called cilia, and then they have these like Hoover power drive vacuum cleaners on the outside, and they suck the immature egg cell into the fallopian tubes, okay, into the oviducts. They travel around this particular region, and if a guy ejaculates inside the vaginal barrel and is able to get some sperm up into the region, it will leave the vaginal barrel, enter the cervix, move up the entire uterus, go into the oviducts or fallopian tubes, and then get into proximity, close proximity, to possibly fertilize an egg. And as I told you before, if you had one sperm cell and one egg cell, you would not get pregnant. But hundreds of thousands of sperm cells made it to this region where the egg is picked up over here. It's usually the lateral 1/3 of the fallopian tube. You have hundreds of thousands, maybe even millions, that made that journey. And their heads explode. The heads are called the acrosome of the sperm. They explode, exposing DNA material and blah, blah, blah. But they also expose the hormone that I mentioned already called hyaluronidase. This enzyme is responsible for breaking down the wall of this egg cell, this mature, released egg. So it only takes one, but you need millions to actually get there. All right? Now, if fertilization takes place, it makes its way down, and then it works its way into the uterus. Once inside the uterus, that process can take 2 to 7 days to fertilize and move down and actually start embedding itself inside the lining. The process of embedding itself inside the lining of the uterus is called nidation, N-I-D-A-T-I-O-N. Nidation is the process of embedding itself into the wall of the uterus. Any questions so far? Hello, yes?
What happens to the other like 10 to 14 eggs?
Well, there you go. Now you're talking. That's why we need questions. Now, just a note. What's your first name? Okay, I won't forget that. We have estrogen and progesterone being secreted to develop your organs so that they're ready in case an implanted fertilized egg occurs. You have nutrients there. You have a buildup of the lining of the uterus. But you need hormones being secreted for about 3 months for the entire first phase of pregnancy. Well, here's what happens. And you're going to hear about a word. And the cells that remain, this you write down, folks. I really want you to write it down because it has to enter your head. The cells that remain inside the ovary are temporarily transformed into an endocrine gland. No. No, because you got to spell check. Endocrine. E-N-D-O-C-R-I-N-E. Endocrine gland. These cells that remain are temporarily transformed into an endocrine gland called the corpus luteum. And this corpus luteum inside the ovaries will secrete progesterone up until the first phase of pregnancy, or up until the completion of the first phase, or first 3 months, until the placenta could take over to nourish this growing embryo. By the way, what I meant was, I'll put everything on Blackboard. Spelling's not that important now, all right? So, interestingly, corpus luteum in Latin means yellow body. And it looks yellow when they look under a microscope and they're able to see the cells that remain inside your ovary. So the corpus luteum means yellow body. These are the cells that remain after ovulation that we're developing. They're temporarily transformed into an endocrine gland to secrete progesterone up until the end of the first trimester. Did I answer your question? That was a good question, because I had the answer. That's why it was a good question. Any other questions? Yes?
What happens if there is no fertilization to begin with?
If you don't have fertilization, you have a very sophisticated nervous system sending messages, okay? And I'll call this the corpus luteum again, all right? Once fertilization does not take place, this is good, another good question. There's a message that says, don't need you anymore. The corpus luteum, you will have a shutting off of blood supply to the corpus luteum, a shutting down of progesterone to the other organs, and you have necrosis, death of the corpus luteum. That's the menstrual phase. You hit it right on the head. What is menstruation? Menstruation is actually death of the corpus luteum. When the corpus luteum dies, you have no more progesterone being secreted to the endometrial lining. So when you have death of that lining, it will domino its effect into death of the endometrial lining as well. You got that? Because that's what's secreting progesterone. While we're there, we might as well hit on a very important point. Progesterone, the hormone progesterone, which is secreted by the ovaries, gives women generally feeling of exhilaration. They feel good. They feel happy. It's a nice hormone, okay? When you shut off that hormone, when a female is going through the cycle and it's shut off completely, she goes from feeling pretty good to a total shut off of that hormone right before she has her period. What do we got? What is that? PMS, possibly. Do you understand? It's physical. We have a hormone that makes women feel good. We shut it off. It's done. Until the next cycle where it starts happening again. Now, I'm not going to go too far on the use of that time of the month for excuses. I'll just make a few comments on it. Some women really have heavy cramping, heavy bleeding. It's painful. It's uncomfortable. They get notes to not go to physical education. They get out of other things. I can't, my period, and all that other stuff. It's real. And there's other girls that just use that as an excuse. Sorry, that they're okay, but they just use it. And I think the majority of women, I believe, just go on with life. It is what it is. They have some happy and sad feelings at the same time. Because every month, I'm not pregnant, or if you miss it, shit, what's going to happen now? Okay, but there's the cycle. And very nice questions, you understand? What I'd like to do now is I'd like to move a little bit forward. If implantation occurs in the uterus, here's the pathway that I just went over. 10 to 15 egg cells begin to mature. One mature egg released from the ovary. The cilia of the fallopian tubes, which I mentioned, sweeps it up. The ovum travels to the uterus through FT. What's FT? Fallopian tubes. Fertilization occurs if sperm penetrates an egg cell. Implantation occurs in the uterus. If you lose a fallopian tube or ovary for any reason, damage, trauma, illness, collapse, that does not mean that you can't get pregnant. Your body will compensate for a shutdown ovary, and the other ovary will begin to pick up the slack. The question is, do you have every other cycle an egg being released from the right one, then the left one? No. But over time, it seems to balance out. But if you didn't have an ovary, or if it was removed, the other ovary generally will pick up the slack. So I don't want you to give up hope when you have any trauma, disease, or problems relating to the fallopian tube or ovary. A medical question, but there is hope. Now, approximately 1% of all pregnancies result in something called ectopic pregnancy. Ectopic means in a place where it shouldn't be. Let me get a picture of where it shouldn't be. So I'm going to have to go back again. It shouldn't be up here, high up in the uterus. It shouldn't be down below in the cervix. The best place is really in the body, in this particular region, from here to here. All right? Now, so you can have pregnancy, you can have a developing embryo, let's just say a fertilized egg that gets implanted. You can have it in the ovaries, in the oviducts, high up here, or down here. All of those are not good. Does it mean definite death? No. It means that your body's going to have a real tough time housing that growing embryo into a fetus. Now, if they occur in the ovaries, you'll have pain and discomfort. You'll probably feel miserable for a few weeks, but no real danger. And it can burst through, in fact. If it occurs in the fallopian tubes, listen to this one. The fallopian tubes are designed to not be able to expand and contract like the uterus. So if you have an ectopic pregnancy in the fallopian tube, it starts growing in the fallopian tube. And after 2-3 weeks, it starts bulging. After 5 to 6 weeks, in that range, usually it never hits the 7 or 8 week period, but around 6 weeks, you might have a rupture and a bursting out of the wall of the fallopian tube. Is it dangerous? It's so dangerous and so painful that you'll be rushed to a hospital, and some women die from it, okay? I'm not here to scare you. That's the bottom line. But there's so many warning signs. There's so much discomfort that it doesn't get that far. 99% of all ectopic pregnancies occur in the fallopian tube. So when you hear of women having an ectopic pregnancy, it's all in the fallopian tube, almost always, 99%. And that's why I want you to know, if you ever were pregnant and you had really severe pain, you don't need me to tell you to go to the doctor. But, you know, they know already where the growing embryo is occurring. So, you know, now they can really get ahead of these. But years ago, we didn't have that particular capability. 99%. But if they are high up in the uterus or down below by the cervix, down below by the cervix is real interesting. What happens is right before birth, you carry a baby to term. It's really low down the placenta. And what happens is you have a placenta previa baby, it's called. The baby often comes out, the placenta often comes out before the baby. And you very often have death of the baby, cutting off of oxygen to the baby, and possible death of the mother. In our medical ethics in this country, it's always save the baby first. Excuse me, wrong. Save the mother first, not the baby. That's the way it is. That's the way they work. I don't have anything to do with that. So it's kind of dangerous, this placenta previa. I was a placenta previa baby. Basically, your mom will hemorrhage, and you're going to lose the kid. And that's why I am the way I am. I lost a lot of oxygen at birth, probably, you know. I don't know. But high up here, they usually don't last, and you usually have miscarriages as well. Not usually. I don't want to say usually. Most ectopic pregnancies occur in the fallopian tube. There was a hand over there before. No, there was a young lady. You want to?
Well, if you have an ectopic pregnancy, how do they get rid of the pregnancy? Do they cut the fallopian? Like, what do they do?
If you have an ectopic pregnancy, they're going to probably do a procedure on you to remove the growing, whatever stage it's at. Commonly called a DNC, abortion, whatever you'd like to call it, depending on your affiliation. And you get it? But it
doesn't damage the fallopian tube, though.
well, if you continue on with that and it bursts the fallopian tube, yes, it can damage it. You can have a collapsing of it. There's a very sophisticated air supply that goes in there, and you can have a collapsed fallopian tube, and it's not that easy to get it up again. But remember, you have the other one. The reason I say that is I want you to always know that you have two. God, whatever God you believe in, understood, you know, you got two eyes, you got two ears, you have two breasts, two fallopian tubes, two ovaries, and God was smart enough to know that we can only give guys one penis, though, you know, because he could hardly deal with that. What would happen if he had two? I'm sorry, did I answer your question? Did you have a question before, young lady? Okay, go ahead.
Oh, can they like transplant it and like implant it somewhere else? Or?
Yeah, but they usually, if it's problematic like that, listen, if you get to a doctor early and you go for your checkups, they could do sonograms. They could see where the baby's growing. So today it doesn't have to happen the way I just said. But people who don't care about or say, I'm not going to wait, I'm going to wait 5 months. I'm talking about really the underserved, at-risk, people without health care. You know, today it's much less common for people that are seen by doctors early, okay? So I don't want, you know, but the truth is, we still have 49 million people uninsured. Then we have another 30, 40 million that won't have this particular type of policy where they can get care, enough care. We should all be worried about that. Some other questions?
What section were you in? You know?
I was down here, trying to get out.
So that.
The placenta comes out first. That means your mother hemorrhages. That's what happens. All of a sudden, instead of water breaking, she has blood coming out of her. That's a placenta. Rush to the hospital. If you're lucky enough to get there, they could save the mother. Baby's not a chance, but I'm here. No, but that's the, you know, I read up on this. You know, was I lucky? They could have lied to me. Parents could tell you any story. This is what happened to you at birth. You got to trust your parents, you know. My mother was playing Mahjong, you know, the game Mahjong with her friends, and boom, you know, so. I would have been 6'5", by the way, if this didn't happen.
What are other reasons that a woman would miscarry a baby? Why?
Oh, miscarriage. Why do women miscarry? Her lining might not develop properly. She might have hormonal imbalances where there's not enough hormones, and they can provide hormonal treatments for that. There are many reasons. Trauma, underweight. I can't tell you. There might be 20, 30, 40, and it's a medical question. But what I want you to know, this is something you need to understand. When an egg is fertilized, you will find that some women don't even know they're pregnant. In other words, early on, first 6 weeks, things happen and there's a miscarriage, but you don't know about it. It's a small thing, blood. You don't know about it. So many miscarriages go unnoticed and unreported. So I guess, and I'm saying I guess from readings, medical readings, approximately 1 out of every 3 fertilized eggs don't make it. You know, we have this idea, every time it's fertilized, you're pregnant. No, there's so many of these, you know, it's not easy to get going. Sometimes it doesn't, nidation, the process of getting in doesn't work, and it comes out. So many women don't even know they're pregnant. They know they missed a period, they know other things. Now you ask me, I can't answer it, because every person should be treated individually when it comes to miscarriages. I can tell you there's always hope. So when they have 2 or 3 miscarriages, and many women have this problem, it's usually during the adoptive procedures that they naturally get pregnant on their own. It's incredible how many, and a lot of this, and I don't want to put things on stress, that's my field, but a lot of it has to do with anxiety and releasing of hormones when you're under a lot of stress. So the more you work towards it, the more you stress over it, the more anxiety you have, the more difficult it is for your body to behave normally or the way it typically does.
Does heredity?
We don't have the answers yet, but if your parent, I can't say whether it matters. We know that if your mom and grandmom had miscarriages, you're more likely to have them. You could do what you want with that information. Because in epidemiology, they'll give you an odds ratio, and they'll tell you, oh, you're 1.5 times more likely. Do you understand? We have a professor here, Dr. Deb Nelson, who's a great professor, who studies a lot of these particular issues in women and reproduction. And she's an epidemiologist. Yes?
I guess it's kind of personal, but if you're an overall healthy person, like my mom had
Yeah.
disorders, so she wasn't able to
Yeah.
miscarry, like she had like 3 miscarriages.
Yep.
But if you're an overall healthy person, is it still as likely that you would miscarry? Hereditary-wise? Heredity-wise?
If you're unhealthy, it's less likely. So obviously, it's more likely you'd be fine. Health does matter, your overall health. You know, there's so many risk factors that I didn't talk about. Remember when I was talking about egg development, sperm development? No, when I was talking about things that can affect you, radiation, altitude. We're not even getting into environmental areas. We're not getting into nutrition. But overall, if healthy individuals have better births, better birth outcomes, larger babies, women that smoke. You know, I hate to say this. Women who smoke have small babies and more stillborns and all that. I mean, you know that, right? I mean, you know the dangers of smoking because everyone knows that. But that's what I'm talking about. All those factors, you know, not smoking, being fit physically, you're more likely. The big thing is you're more likely to not become overweight. Women can gain 60, 70, and 80 pounds. And the baby's only what? 6, 7, 8, and then you got about 10 to 15 pounds of stuff, you know, amniotic fluid. Well, they could gain that, and if they gain, I'm sure their partner gains that much weight too, because you got to eat with them. That's the deal, and that's unhealthy, somewhat dangerous, you know, and difficult to get off. It's also unhealthy down the road. Yes, health matters, but I don't want to, you know, you never know. Being overly, here's what I should have said. I'm sorry. I take back everything I said to you. I want you to know when someone gets pregnant, ladies, when you get pregnant, guys, when your partner gets pregnant, she should not change her lifestyle that much. It's more important that she stays within the same routine and regimen that she had before, and other than giving up alcohol, tobacco, and other drugs. So when someone is never exercises, then they get pregnant, I'm going to be fit for my kid. Don't do it. Keep the same, because your body can't take that huge change. Big changes in your body affect your fetus. So if you're a person that exercises all the time, just continue to do it while you're giving birth. Just run into the hospital. There are some people that gain, we knew someone, my wife and I knew someone, her tennis teacher, who gained 7 or 8 pounds during her pregnancy. Because she worked out day and night, and probably was engaged in whatever her sexual activity was. Don't stop having sex unless your doctor tells you no. That's another one. You know, there's nothing. You know, it's keep things as they are, and don't start. The other thing is diet. Don't start eating whole grains and yogurt and rice cakes and soy products if you're not used to it. Your body reacts to this significant change. If you want to do it gradually, it's not a bad idea. But prepare in the before. You know, why don't you live healthier before that time? There's a hand over there. Sex during pregnancy for who? The guy or the girl? It has no impact whatsoever. The activities that you're supposed to give up are skydiving, highboard diving, and downhill skiing. And what I'm trying to tell you is just do whatever you were doing and don't do stupid things. And sex is not stupid. Unless you have problems. And doctors will tell you right away. Now, some women will use that as an excuse. I can't have sex. I had spotting. When you were supposed to have your period, very often you're going to have a little bleeding occurring. And it's very common. And so a lot of women are going to, you know, abstain. I just want you to know, it's a doctor's question. And a lot of women ask, am I allowed to have sex? I hope your doctor will say, if you were having sex before, just continue with your routine. It shouldn't be forced. You're not going to hurt the baby. If you're worrying about the baby, baby's fine. I mean, psychologically, they could be damaged. What the hell's going on in here? Woo! You know, who knows what's going on in utero? My belief is a lot goes on. You know, like 8 months, they probably hear you. I hear you, Daddy. What the hell are you doing up there, you know? And how far can you have sex? Until it's very uncomfortable for the woman. And that's why positions of sexual activity often change. But I always have guys walk like this, you know, for about a week and see what happens. You won't want to have sex. you want to lie down and get your swollen feet up in the air. So that's the answer to your question. Just continue what you were doing, and other than the drugs and the other stuff. And I don't know why I'm looking at you. You asked the question. What else you got? We're good? All right. So let me get to this. There's 4 things. I want you to memorize this. I don't want you to know this. I want you to memorize this. It's also going to be on Blackboard. We already went through this, but I want to give you the balancing. I have 15 minutes to go over this 3 times. Do you think I could do it? You don't even know what's up here. You're saying yes. Okay. Estrogen and progesterone are hormones secreted by the ovaries. They help to develop your internal organs for possible implantation of eggs, with about 50 other factors that it affects. But I'm just talking about this for now. We have LH, luteinizing hormone, secreted by the pituitary, and FSH, follicle-stimulating hormone, which is secreted by the anterior pituitary as well. Now, I'm going to talk about these hormones a lot. So don't worry if you don't get it the first time around. Just listen, see if you can get this, all right? I mentioned that estrogen begins around age 8 and when remodeling starts occurring. So let me get to the cycle itself. Here's what happens. Yes?
About 5 minutes on this tape.
Okay, so I'm going to go through this once so we get it on tape. And then I'll go over it another 2 times, not on tape. The first thing that happens is FSH is secreted. FSH is responsible for the maturation of mature eggs. LH is responsible for the release of mature eggs. Estrogen and progesterone exist for the preparation of fertilized eggs and implantation. So the cycle works like this. We start off with FSH being secreted, okay? And after it's secreted, as the level of FSH goes up and gets high, it will trigger estrogen. So FSH goes up, your body starts it's maturing egg cells. You have estrogen being secreted when this gets to a certain level. So estrogen starts coming up, and as the level of estrogen increases and it gets high, it inhibits FSH. So there's a real interesting relationship. As FSH goes up, it triggers estrogen secretion. As estrogen gets high, it inhibits FSH. Now, if we move to number 2, I already mentioned it inhibits FSH. But as the level of estrogen increases, it causes a new hormone to be secreted, LH. LH is responsible for the release of a mature egg. So around the ovary, can we get this on? Doesn't really matter. Around the ovary, you have a puckering. It almost is a nipple-like effect. It fills up with fluids, and it pops out. This egg cell pops out. And this is due to LH secretion, luteinizing hormone secretion. So FSH is responsible for the maturation of egg cells. LH is responsible for the release of this egg cell. Once you have LH being secreted, it triggers a new hormone. So as the level of LH goes up, luteinizing hormone, it will trigger a new hormone, progesterone, to be secreted. And the same effect occurs. As the level of progesterone increases, it will inhibit LH, and then you're there. So what I want you to know is you have this inverse relationship, or let's just say a relationship, with estrogen and FSH and LH and progesterone. They actually trigger the onset of, and too much of estrogen will actually inhibit FSH, too much progesterone will inhibit LH. So when you inhibit, what you end up having is FSH and LH being suppressed. When you have suppression of LH and FSH, you're actually not going to ovulate. You don't have a development or a release of a mature egg when you take any type of oral contraceptive. If you're on the pill, it mimics this whole idea. It gives you enough progesterone and enough estrogen combined in a pill or in an implant or in a stick and in a shot, enough of these hormones to suppress typically both FSH and LH. If it's progesterone only, it's only going to inhibit LH, so you don't have a release of mature egg. That's what the pill is. That's how it works. Next class, I'm going to come back to this. I'm going to go over it 2 or 3 times so that you kind of get it. Let me just finish up here. Ovulation is the release of mature egg cell by the corpus luteum. We already mentioned the corpus luteum. But if implantation occurs, the corpus luteum continues to secrete progesterone until the end of the first trimester, which I already went over. If fertilization and implantation do not occur, you have death of the corpus luteum, which is menstruation. And when you have death of the corpus luteum, you have FSH being secreted. And what do you have then? You go back to FSH is secreted. It will then trigger estrogen. As estrogen gets high, it will inhibit FSH. As estrogen goes up, it will trigger a new hormone, LH, to be secreted. When you have high levels, it's going to, did I say that right? No. Yeah, I did. I'm sorry. It gets confusing. But anyway, as increase, you will trigger LH from being secreted. LH will then trigger a new hormone, progesterone, to be secreted. And as the level of progesterone goes up, it will inhibit LH, and you will not have enough to have a release of mature egg. Now, this is without oral contraceptives being involved. So that's how the pill works. It combines enough hormones, usually progesterone, some estrogen, to inhibit FSH and LH from being secreted. Hence, you don't have maturing and releasing mature egg cells, no pregnancy. Don?
We have like a minute or two.
We'll have a minute or two, okay? Now, before we have a minute or two, and I will go over this many times. Do you get it? Do you see the relationship? It's just a balancing act. It really, these hormones work together. They work together. That means, you know, you don't have high levels of this and low. It's kind of always being balanced. And when women go through hormonal therapies, it's trying to get back and regain that balance. But the bottom line here is this is how the pill works. This is how oral contraceptives work. This is how the shot method works. This is how all the subdermal implants work. These are how the 21-day pill, the combination pill, which is what most women take, and even sequential pills from years ago, which don't even exist.